It's totally unacceptable.
One family in Beausejour, Manitoba is raising the alarm about medical transport services as their mother, who has cancer, has missed several necessary treatments due to the lack of transportation services. Derek Karpa has had to take matters into his own hands after his mother's cancer treatments kept getting delayed. Due to a lack of staffing and medical transport services, he has had to hire a transport service out of pocket to get his mother to cancer care.
We've had 4 appointments altogether postponed from the time her treatment started to the time her cancer treatment has been completed.
Both Derek and Michelle Karpa reached out to John McKay, the owner of Community Paramedic Service, for help, but were ultimately told they could not use his service. McKay is a retired paramedic and started a wheelchair transport service when he saw there was a need during COVID.
Why is he not being utilized, especially when there's so many people being appointments canceled and postponed?
Since May of 2022, McKay's team has completed over 6,000 medical transports from all across southern, Interlake, and western areas of Manitoba. He says they continue to transport patients until the regulators of the Emergency Response and Stretcher Transportation Act said they could not transport patients from hospital to hospital.
It's disappointing. It's frustrating. It makes me angry as having been a past healthcare worker, to know that this is happening to vulnerable people that don't have advocates.
McKay and his team continue to make several medical transports every single day, but are doing so privately.
The toll is mounting. People are not making their appointments, and it's hurting families, and it's hurting caregivers.
Shared Health confirmed McKay's company is not a contracted service provider and would not confirm whether or not there has been an increase in appointment cancellations due to a lack of medical transport options in rural Manitoba. But McKay says patients are continuing to miss their appointments through no fault of their own.
And if the government doesn't revisit this, it will only get worse, and people will continue to not get their therapy, and it affects longevity.
Both Michelle and Derek just want to give their mother the best care possible.
I'm frustrated, and we pride ourselves on our healthcare system here, and to hear that this is what's happening and to experience it ourselves, it's unacceptable.
In Winnipeg, Alex Karpa, City News.